Imagine a world without tobacco. It's easy if you try. No harmful smoke around us. Above us only a clear blue sky. Imagine all the people breathing clean, fresh air.
The susceptibility of youth to tobacco is alarming. Despite laws, accessibility remains a concern. It's time to take action and protect our children from the harms of tobacco. The existing evidence highlights unethical practices in the tobacco industry, including promoting sales near schools and using different forms of traditional and digital media to advertise their products to children and adolescents.
আমি তারেক ঢাকায় থাকি 2 বছর আগে সিগারেট খাওয়া শুরু করছি বন্ধু বান্ধবের পাল্লায় পড়া সিগারেট খাইতাম এখন সিগারেট খাওয়া ক্ষতিকর এবং সিগারেট খাওয়া ছেড়ে দিচ্ছি
ในยุคปัจจุบันนะคะหลังจากที่หนูได้พบเห็นจากสิ่งรอบข้างหรือว่าสภาพแวดล้อมนะคะในเรื่องของบุหรี่ไฟฟ้าก็จะมีเป็นเยาวชนค่ะที่อายุประมาณอยู่ในช่วงของม.ต้นแล้วก็มัธยมปลายค่ะที่สามารถพบเห็นได้ว่ายุ่งเกี่ยวกับบุหรี่ไฟฟ้าค่ะ
Flashy packages, they're a sneaky way to grab attention. The highly addictive nature of nicotine, coupled with false claims about reduced harm by the industry, perpetuates addiction and necessitates immediate action. The tobacco industry prioritizes profit, targeting children and adolescents with exploitative tactics. It's time to safeguard our future by taking action against their harmful practices.
Imagine no tobacco industry. I wonder if you can. No more disease or suffering. A world where everyone can understand. Imagine all the people choosing health and life.
Tobacco's harsh reality is that it causes death, suffering, disease, economic hardship, and family devastation and harms the environment in a big way, tearing apart society and urging for an end to lies. The truth is increasingly evident as tobacco's grip tightens, leaving a trail of destruction. It's time to confront lies, expose tobacco's insidious nature, and take a stand against this deadly addiction.
You say I'm a dreamer, but I'm not the only one. I hope someday you'll join us, and the world will be tobacco free.
Good afternoon and a very warm welcome to all our viewers to today's World Health Day special event on the occasion of World No Tobacco Day. Tobacco use is the single most preventable cause of death globally and is currently responsible for killing 1 in 10 adults worldwide. Every year on 31st May, WHO and various health associations everywhere mark World No Tobacco Day, highlighting the health risks associated with tobacco use and advocating for effective policies to reduce tobacco consumption. This yearly celebration informs the public on the dangers of using tobacco, the business practices of tobacco companies, what the WHO is doing to fight the tobacco epidemic, and what people around the world can do to claim their right to health and healthy living and to protect our future generations. In keeping with this year's World No Tobacco Day theme of protecting children from tobacco industry interference, we have an esteemed panel of experts who will be discussing about the need for stricter implementation of anti-tobacco laws and the need for impact of innovations in tobacco control. Our panelists for today are Professor Dr. Sonu Goel, who's presently the Professor of Community Medicine at the prestigious Postgraduate Institute of Medical Education and Research at Chandigarh, and also the Chair for Tobacco Control Section at the Union. Then we have Dr. Gopal Chauhan, who serves as the State Program Officer at the National Health Mission for the state of Himachal Pradesh. Then we have Dr. Rakesh Gupta, who's presently the President of the Rajasthan Cancer Foundation. And Last but not the least, we have Mr. Cyril Alexander, who's the founder and the executive director of the Marianne Charity Trust. It's a pleasure to have you with us today. Thank you so much for being a part of this World No Tobacco Day discussion. To lead the discussion and moderate the panel, we have well-known tobacco control expert, Dr. Rakesh Gupta. Dr. Gupta formerly served as the Director of Health Services and also the Director of the Chemical Examiner Lab in Punjab. Presently, he is the President and Director of the Strategic Institute for Public Health Education and Research, called as CIPHER. It's a pleasure to have you with us today, sir. Welcome, and over to you to please drive the discussion.
Thank you, Manisha. So you have already introduced about the World No Tobacco Day. And I may tell you that protecting children from tobacco industry interference is the theme for the World No Tobacco Day this year. It will give a platform to the young people across the world who are calling for the tobacco industry to stop targeting them with products that are harmful to their health. Young people, that globally they are calling on governments to adopt policies that shield them from manipulative practices of tobacco and related industries, including the relentless marketing of their dangerous products through social media and streaming platforms. And as most of us, they know that India adopted the Cigarettes and Other Tobacco Products Act, that is COTPA, and the law came into force in 2004. And the WHO FCTC was ratified in 2005. The government of India has committed to implement the Article 5.3. But the challenges and the opportunities, they are also there. So there are many gaps to be addressed. The law allows selling of the single cigarettes. The law does not ban selling of non-licensed sellers. Then the point of sale advertisement is allowed. Designated smoking areas are allowed in selected places. The tobacco products are not regulated as provided under the COTPA 2003 in view of lesser number of the tobacco testing labs being available to do so. There is no regulation of extensive surrogate indirect media campaigns which promote use of pan masala, leading to violation of Article 13 of the WHO FCTC and Section 5 of the COTPA Act as it pertains to brand stretching and brand sharing. And there's also poorer implementation of ban on smokeless tobacco, mostly pan masala plus tobacco as twin pouches they are being sold. And the ban on e-cigarettes under PCARD 2019 is also not being still implemented as required. So, but we have some WHO empowered measures. So in line with the WHO Framework Convention on Tobacco Control, WHO introduced the Empower measures in 2008. Empower are a set of cost-effective and high-impact measures that help countries reduce the demand for tobacco. These measures, they include M for monitoring tobacco use and prevention policies, protecting people from tobacco smoke, that is aligned to Section 4 of the COTPA, offering help to quit tobacco use. So we'll be asking Dr. Rakesh Gupta, who is an expert in this field. Then warning about the dangers of tobacco aligned to Section 7 of the COTPA, enforcing bans on tobacco advertisement, promotion and sponsorship. That is aligned to Section 5 of COTPA, and then raising taxes of on tobacco. So actually, what we need to do is implement the laws which are already there to reduce the menace of tobacco and nicotine also, right? So we will be having a panel discussion with the esteemed presence of Dr. Sonu Goel, Dr. Gopal Chauhan, Dr. Rakesh Gupta from RCF, Rajasthan Cancer Foundation, and Mr. Cyril Alexander. He's from the MACT. And he's an expert in, I must say that he has created an app, Tobacco Monitor app. So we'll be asking him about the Tobacco Monitor app. So Dr. Sonu Goel, so I'd like to ask you about the doctors' engagement in COTPA, COTPA enforcement, how the doctors can be engaged, how they can be, how we can tell the doctors about the COTPA main sections and how they can be engaged in enforcement.
Thank you, Dr. Rakesh. I think that is one of the questions which are really important, considering the fact that a lot of things have happened in tobacco control in last decade. So, complementing Government of India in implementing very stringent measures, that is effective pack warning, that is 85% of the pack, then banning electronic cigarette and likes products, and hookah ban, and many more things. So these are some of the commendable initiatives by Government of India, but there are, of course, we'll be talking here in this discussion, the implementation issues, the collaboration issues, the priority issues, like whether COTPA or our act is being given due priority as comparison to other national health programs, awareness issues, whether people are really aware about the act, not about the tobacco, but about the act. So are we really aware about it? And then about that mighty tobacco industry. So these are some of the issues which are actually we are facing. If we go to this specific question on doctors' involvement, so that needs to be there because doctors are the face of our society. Face of the society means that whenever people come to them, they have a lot of expectations. They have a lot of, and people listen to them. And whatever they say, so people try to emulate them, people try to follow them, right? And it has been said by various studies that when people come to them, not only for tobacco use, but for any other thing, so that's an opportunity which doctor can easily adopt to convince the patients that you need to do these things. Say, for example, when a person used to come after a heart attack to doctor. No, so when they come to a doctor, then doctor advises him to do physical activity, to refrain from smoking, and all those things. And people normally abide by them rather than listening to their family members. So it is very necessary, very important right now to involve doctors in this tobacco control phenomena. Now, we used to ask that as a doctor, during our MBBS days, during our MD days, we all know about tobacco harms. We all know about harm. So why there is a need for sensitization? You know, the awareness and behavior change are two different spectrums. It is not necessary that if the doctors are aware, so there is a behavioral change which has taken place in them. So awareness and behavioral change is really important. That is number one. They need to be do that. And second most important thing about being awareness of the doctor is about the law. Because most of the doctors might be aware about the harmful effects of tobacco use, smoking, but they might not be aware about our act. What is actually there in the act? So that is another thing which they need to be aware about. Now, what are the opportunities where doctors can be involved? So there are various associations of the doctors. So we need to involve their association members. And tobacco is one of the, I always say that tobacco is one of the opportunity where we can involve any association because of the fact that tobacco causes harm to any organ, be it lungs, be it heart, be it our ENT, be it our reproductive tract. So each and every association can be involved. So this is one good thing that whenever we are talking about tobacco, so if we talk about tobacco harmful effects with relation to a particular organ, so I think nobody can deny, no organization can deny that this will not happen because of tobacco. So we can always pitch in their associations, in their conferences, in their meetings, in their workshops, whatever is happening. So I think doctors can be pitched there. Second, we can form associations of medical colleges. So what one thing this PGI has done is they have made a consortium of All India Institute of Medical Sciences across the country, where they are assisting those aims. These are the renowned, prestigious organizations. So they are mentoring those aims in making their action plan and a detailed action plan, what they will be doing. And I'll happy to inform you that They are doing excellent work. They have formed a committee within the institute, forming of members from different departments, and awareness campaigns are being held. The tobacco cessation clinics has been rejuvenated in their institutes. A lot of sensitization for the students, those people who have recently joined, MBBS student who joined the first year. So they are being aware about these things. So these are some of the activity which we can do by involvement of medical college, and we have similarly done so with other medical colleges also. So we have, after making consortium of AIMS, so we have made a consortium of 30 medical colleges who are doing the similar thing, and AIMS are assisting them in doing these things. So these are some of the things which some of the venues or some of the opportunity which we can always involve doctors in preventing tobacco use.
Dr. Sonu, can you please let us know about the various sections of the COTPA? I mean, 4 basic sections of the COTPA, so that doctors they know about the laws.
Yeah, I think in a general language, although COTPA, everybody here who are here, so it takes one day to explain the entire law. But in very brief, for the doctors, if we have to understand it, there are various sections. 4 sections are really important. Section 4 is one section, so where the people cannot smoke in public places. Because of the fact this section has been made, because of the fact that people usually say, I have a right to smoke, but then the person who is non-smoker, so they are exposed to that harmful smoke. And I must tell you that out of 13 lakh people who are dying per year, 14 lakh in fact, who are dying per year in our country, so around 2 lakh people, 1.5 lakh people are actually dying of secondhand smoke, who are innocent bystanders of the person who is actually smoking. So that's why the law section 4 says that nobody can smoke in public place. And if somebody is smoking, so that person can be fined for 200 rupees. And that can be multiple fines for a same person. So that is one thing which we should know in a simple language. Section 5 is talks about point of sale, like where the people are actually buying and selling tobacco, the shops where the tobacco is being sold. So there are various provisions in section 5 which talks about what type of banner or what type of things can be there for the shops. So it is about this. Section 6 talks about the schools, educational institutions, or colleges, or all the educational institutions, whether it is primary, secondary, all education institutions. So they have to put the board outside the educational institution. That is section 6B, that there should not be any sale of tobacco products within 100 yards. So it is approximately 100 meters, 90 to 93 meters of the educational institution. So the educational institution also include the medical colleges where you are in. So if somebody is selling tobacco products within 100 meters of the periphery, of the entire periphery of the institution, so that is not correct. And section 6A actually talks about selling of tobacco products to the minors. So nobody can sell tobacco products to the minors. So that is section 6A. And 7, 8, 9 sections talks about the package warning. So that is not very much important for in general for you, but section 4, specifically 5, 6 are really important for us to understand the.
Yeah, thank you, Dr. Sonu. And I may add that section 5, under section 5, actually, the surrogate ads, they are also banned. So we need to ban, there's a ban on tobacco advertisement, promotion, and sponsorship. Yep. So I think we can add that also. And there should not be any tobacco depiction in TVs, I mean TV serials, films, and then the film and television rule that also comes under that section 5. And now there is ban on tobacco depiction in OTT platforms also. So thank you, Dr. Sonu. So Dr. Gopal, I think we need to know about other anti-tobacco and anti-nicotine laws which are available to us and which all doctors need to know about.
Thank you, sir. Am I audible?
Yeah, you are audible.
Okay. Thank you, Doc Plexis, for giving me this opportunity, and thank you, Dr. Rakesh, for asking this, this question. As we know that this is one of the biggest forum in India, where around about 4.5 lakh doctors are connected in this, in this group. And you have specifically asked that, what are the related laws in relation to, in addition to Kotwa 2003, which can help us, in reducing tobacco in the country. Specifically saying that, lawmaking in India is something that the biggest law of the country is the Constitution of India, and every law, every act is driven from the Constitution of India. As per the Constitution of India, we are having two kind of subjects. One are in the central list and one are in the state list, and few are in the concurrent list. It means state and central government both can make laws and rules for that. If we talk about tobacco, it is mainly in the central list, but the trade, commerce, supply, and distribution comes in the state list. It means that tobacco is in concurrent list. It was a, previously it was presumed that it is purely a central government subject, but now we can understand that this is both central and state government subject. Lawmaking in India, as far as this tobacco control law is concerned, it started in 1975 when the Cigarette Act was enacted by the Government of India, which was mainly focusing on restriction on trade, commerce, supply, distribution of cigarette and other tobacco products. After that, we enacted the comprehensive law, the Kotwa 2003, about which Professor Sonu Goyal has described in detail. Now, what are the related laws which can also contribute for tobacco control? My personal opinion that we should strengthen Kotwa 2003 as much as possible, so that there is no need for any other, similar laws for tobacco control. We should try to strengthen tobacco control, this is a very specific law, very specific issue for tobacco, and specific law has been made in India. But apart from this, many laws can help, and they are more powerful in up to some extent. For example, if we talk about the Food Safety Standard Act, you know that the bigger problem in India is smokeless tobacco, which is not being regulated effectively, and there is no strict provision in Kotwa 2003. Only what we can do, we can restrict sale within 100 yards of education institutions. Otherwise, there is no provision for banning or stopping smokeless tobacco in India. But under Food Safety Standard Act, under the provision, regulation 2.3.4 of FSSAI 2011, it is clearly mentioned that the tobacco is considered as a food item because it is eaten for taste and nourishment. So it is a food product. We regulated it in India under that act, and you can see the impact. There is a visual impact now. And yes, there are a lot of gaps, but still we need to implement the provisions in letter and spirit. After that, we have a very strong law, which is Juvenile Justice Act 2016. Under section 77 of this act, there is a provision for imprisonment, and there is a fine up to 1 lakh rupees if anybody is found selling tobacco product to a child. It means that under Kotwa we are only talking about 200 rupees fine under section 6, which talks about the children and adolescent age group. But we are having a very, very strong punishment provision here in the Juvenile Justice Act if we implement this. After that, we can think of the Human Rights Act 1993 and the revision which has been done in 2019. As per the Constitution of India, fresh air is a right of individual under Article 47 of the Constitution of India. Then we can say that we can go to the court that our rights are being violated by a smoker, and he should not smoke in a public place or in an environment where I am affected. After that, we talk about the Drug and Cosmetic Act. We can regulate the nicotine and related products under this act, which is the Drug and Cosmetic Act, and somehow electronic cigarettes were being regulated before PECA under this act. Then we have the Environment Protection Act, because tobacco pollutes our environment, through smoke as well as through butts of cigarette and other tobacco products. Here comes the Environment Protection Act 1986 into force. Then Poison Act 1919, tobacco is also considered in the definition of poison. Dr. Gupta, evoked this legislation in Punjab, and he tried to regulate this electronic cigarette through this Poison Act 1990 in Punjab, and he was successful also. Then we talk about the Municipalities Act, where the laws are very clear that the municipality within their jurisdiction can make laws about the tobacco vendor licensing, where smoking is allowed, where smoking is not allowed, to use tobacco products in certain places, and where it cannot be used. The municipality laws in many jurisdictions are playing very important role, where they are trying to, and they are trying to ban sale of loose cigarette also, which is beyond the scope of Kotwa 2003 as of now. Then we can think of the IPC section 268, where we can think that it is also a public nuisance, because you have right for fresh air, and if somebody pollutes your environment, creates some nuisance for you, then it can be covered under IPC Act. Then specifically for electronic cigarette, which is, although it is not a tobacco product, but it is considered to be as dangerous as tobacco product. Then the PECA 2019 came into force, and now we have a very strong provision under PECA, because it is considered that if we use the electronic cigarette, it is also addictive, and definitely there are chances that the tobacco use will increase. Also, it is considered to be a very, very danger sign for few of the diseases that you can be addicted, as well as some cardiovascular accidents can happen. In the end, I would like to say that we have multiple legislation apart from COTPA in India, that which can be evoked, they can be enforced. But ultimately, we should try to strengthen COTPA 2003 as much as possible, because it's a very specific law for a very specific issue. Thank you very much.
So thank you, Dr. Gopal. And I think the new menace, the nicotine pouches, that can also be dealt under Drug and Cosmetic Act. And moreover, I would like to suggest, and I'll also like to suggest the drug.
But you see, sir,
Yes.
You see that the specific laws are made for specific issues. For example, if we talk about the Food Safety Act, the specific purpose of the act is to provide safe food and healthy food to the people. Tobacco has been fallen in that grade accidentally. And the Drug and Cosmetic Act regulates the key drugs, under different schedules. But yes, definitely, tobacco-related products, the nicotine pouches, which are being sold, without prescription and without prescribing any limits, they can be dealt. But yes, definitely, we need to make such provisions in COTPA 2003 when we are going for amendment. Thank you.
Yeah, another thing I want to mention is that drug safety officers, they can still act under Drug and Cosmetic Act to act against electronic cigarettes, and they can also be empowered under PECA 2019 as done by Haryana. So thanks a lot, Dr. Gopal. So now over to Dr. Rakesh Gupta. So Dr. Rakesh Gupta, I will ask you about the new innovations which have been done in tobacco control so that we can go towards endgame tobacco in India as well as in the world.
So greetings to all the participants of Doc Plexus, and thank you for giving me this opportunity. Thanks, Dr. Rakesh Gupta, for also giving me this opportunity to be the part of this webinar. I wish to talk, as you have said, about the impact of innovations. But before that, since you mentioned about my work in tobacco cessation delivery, I just wish to give them few talking points that why assistance in quitting is necessary. Tobacco use is a disease, and every tobacco user is a patient. That's the norm that we need to set in the society, and not only in the society, in all our health facilities, from primary to tertiary level, so that the tobacco using patients can be helped in quitting regardless of their age. This quitting should be offered at every visit to any health facility, at every clinical encounter by all healthcare professionals. And when I say all healthcare professionals, this also means beyond doctors, the nurses, the pharmacists, and counselors, and so many other colleagues that work with us in tobacco in hospital. Lastly, if the doctors or other healthcare professionals cannot treat for the patients for tobacco dependence by using 5 A's, then perhaps it's best that they refer the patient to a portal where the assistance can be provided in quitting. Especially, I would like to mention about the National Quitline services and the tobacco cessation clinics, which are there in the district hospitals. Now, coming to innovations beyond tobacco control, one can say is business as usual that we have been following for over 2 decades and where the success has been partial only. These are 4 innovations that I would like to enlist. One is the licensing of the retailers and the users. Second is tobacco-free gram panchayats, that is making our gram panchayats tobacco-free. Thirdly, talking about tobacco-free generation. And lastly, the end game of tobacco. Let me say that top 3 of these innovations can be used to move in that direction, but we will still need a policy and national advisory for each of these. The last is the best. This is what we need to understand, that end game for tobacco is what we should be looking for. Earlier, the better it will be. Coming to the licensing, which is required for retailers and for users as well. It will reduce tobacco use, especially of the occasional users, also of the current users to some extent. Secondly, it will help us in mapping of the retailers, and it will also help in improving the enforcement of the CODPA and other laws. And lastly, it will also provide higher revenues for the government. Licensing of the users will restrict their usages, cap the amount of tobacco use which they are currently using, and enhance their participation in quitting of tobacco within a timeline. So licensing of tobacco users is not being talked, but I think this is one thought which can be sort of given a movement, because the tobacco using patients who are coming to the hospital, if they are provided a certification that they are tobacco users and will require tobacco use, and their tobacco use in a way can be prescribed as well, I think that entire act of registering a patient for licensing itself will help the tobacco using patients to go for quitting. Coming to the tobacco-free panchayats or making our gram panchayats tobacco-free, it has been introduced in some of the states of India. Panchayats are the core governance units, as we all know it. These are responsible for the enforcement of CODPA as well. The Jilla Parishads can make it happen because they are the governing body for the panchayats in a district. And these can direct the offices, schools, health facilities, which are under their jurisdiction, to be tobacco-free. Tobacco-free generation is a concept. It's already a global movement. It began in Singapore in 2012. It means the birthday restriction, or not letting the children born after a particular date to be ever the tobacco users. This will help primarily to reduce the number of current users, and it will also help in stopping the initiation by the minors. It's unique supply and demand reduction measures. The positive approach is there in it versus the prohibitions or bans, which generally bring about the protests and dissents. This appears to be socially acceptable. Even tobacco industry will not be able to oppose it, because it also wants to have a facade of being the social welfare agency, which it is not. So I think the tobacco-free generation concept requires a greater thrust. Coming to the end game for tobacco, what it means is that the commercial sale of the tobacco should be stopped to all within a timeline. We need to change the structural, social, and political dynamics, which is letting the tobacco epidemic continue and is causing about death of 4,000 adult Indians every day. And therefore, it makes sense for us to promote this message that India should be tobacco-free by 2030 through the end game of tobacco. It requires to be done in a phase-out manner and in unison with other tobacco control measures, especially through the government, the current users, the tobacco industry, and its friend groups. Why end game for tobacco? Because this is one aspect which will be asked. We must know and let others know that tobacco is not a normal consumer product. Tobacco industry, because it kills half of its users if this is used lifetime. So that's one point. Second is tobacco industry is not a normal industry. It's a deceitful industry. It works only for the profit, despite the humongous morbidity and mortality that tobacco products cause. World over, controlling tobacco has succeeded only partly. So it's time to move to endgame for tobacco. And lastly, it's possible through a strong and unflinching political will and with everyone's participation. Coming to the last two slides, as I wish to be specific as to what can be the role for DocPlexus members, that they need to, or we need to get the self-educate to get empowered. The RCTC and Cypher courses are there on tobacco control and cessation deliveries. The members can get registered to it and do these courses for the basic knowledge in tobacco control and tobacco cessation delivery. There is a need to talk about the stronger tobacco control and cessation delivery on every available platform, be it academic, be it non-academic, a social platform, and we need to engage the medical institutes and the institutions and health facilities, as Dr. Sonu has mentioned already. Lastly, it is important to realize and exert our roles as an advocate, influencers, and messengers for policy planners, administrators, and media. We must know that we have the impact, we can create an impact, provided we are committed to for the end game of tobacco and a stronger tobacco control. So I'll end my presentation here. Thank you very much again for giving me this opportunity.
Thank you, Dr. Rakesh Gupta, for letting us know about the concept of the tobacco endgame. And I think all other parts they need to be done for the tobacco endgame. I mean, the tobacco vendors licensing, the tobacco-free panchayats, and what else? Tobacco-free generation also. So they have to be part of the policy so that we can achieve endgame. And another thing is that tobacco cessation, it has to be part of the curriculum. And all the doctors and the healthcare professionals, they need to know when to refer a patient. At least ask, advise, and refer should be the norm for all the doctors and for all the healthcare professionals. And we at Cypher and RCTC, so Dr. Rakesh Gupta is always part of the programs. We run two special courses. That is the program for promotion of tobacco cessation, the induction program in tobacco cessation. So if you have a cohort of 20-25 people, we can always run these courses for you, for your organization. So thanks a lot, Dr. Rakesh. And thank you for suggesting the name of Cyril, because Mr. Cyril Alexander, he has done a great job.
Yes.
He has created that Tobacco Monitor app with which we can very easily register our complaints against the violations of the anti-tobacco and anti-nicotine laws. So thank you. Thank you.
Very well.
So over to Cyril. So Cyril, will you like to play a presentation of PowerPoint also?
So Tobacco Monitor app, you can download it from the Play Store. This is the where you can just simply you can scan it and then you can download it from your mobile. About Tobacco Monitor, it's an open source application where anyone can download it. And then there are many components in Tobacco Monitor application. Complaint, the simple complaint, and then the detailed complaint. There is you can just give a voice message. You can record your voice and then you can send a complaint. You can just take a picture and then you can send a complaint. Apart from that, there is a detailed complaint also there, where you can just give all the information, the photographs, and then section. What are the sections it will cover? So you can just copy and then you can send it to us. Suppose you are not aware of about the sections, and then you can just simply send it, and then we will add all the sections, and then we will make it as a proper complaint. And then you can be a volunteer also. If you want to be a volunteer for World No Tobacco Day activities, or if you want to be a volunteer for any other tobacco control activities in your area, you can register as a volunteer. and then you can get the information through Tobacco Monitor application. In this application, you can also get a notification. Every day you will get a notification about the latest happenings in tobacco control. See, the detailed complaint will be like this. If you want, you can give your phone number and your name. Apart from that, the violation shop or organization name, selection violation type, and then the date will be appeared, the location, state, city, and select the state. And then you can also give remarks, and then you can attach, or you can take picture, or you can give a voice message. So once the complaint is reached, and then complaint sent to the, we will send to the government, and then we will do the follow up, and then we will get back to you the results of the particular complaint. See, the get support, if you want any support, and then you can also register the get support list, where we will refer, or we will give some referral services through the particular concerned departments. And then be a volunteer. Yes, I already explained to you. What does the app offers? See the latest updates on tobacco control, and then you can also link with the civil society members where any activities are happening, and then the tobacco control communities and the networks, especially the civil society networks, like associations and NGOs and other groups. How to install the app? You can go to the Play Store, and then you can see, you can find the logo there, and then you can download it, and then it will be start working it. So is there any other information you want? You can contact through this.
Yeah, I think
thing, and then are in the application.
With this
also
presentation, it becomes easier for you to understand, for us to understand, in fact. So thank you, Cyril. And I may tell you that I have used this app myself, and it is very user friendly. So you may not be knowing about the details of the act also. Even then, you can register your complaints. So thank you, Mr. Cyril. So any last remarks from Dr. Sonu Goyal regarding World No Tobacco Day? Because we are going to celebrate it very soon. So Dr. Sonu, your remarks on, or your message on World No Tobacco Day.
So I think the message which I want to give at this stage is the youth, basically, which is very much involved now in novel type of protests. Electronic cigarette is coming up in a big way, despite government has nipped the things in bud, but still we can find the electronic cigarettes. So first message which I want to give is we need to educate youth about the harmful effects of electronic cigarette, because people still are not, students still are not aware about harmful effects of it. So this is number one. Number two, even our policymakers, bearing health professionals, even health professionals are not aware about electronic cigarettes. They are divided into whether it can be a cessation device or not. So they are still divided. So we must be very categorical in saying that there are much better cessation techniques which are available. We have very effective techniques. So electronic cigarette is not a cessation device. So this is second thing which we need to convince to our fraternity, our doctors, that those who are listening, I think this is one message. The electronic cigarettes is a very harmful device, and it can cause various ill effects similar to what we have observed in tobacco use. So we need to educate them, and also our policymakers, of course, those who are making those policies. So these type of things should be incorporated in the curriculum of medical education. So if we have some policymakers here who are listening to this webinar, so I think we need to make a justification of, there is enough justification to it, but we need to make a case to include these chapters on tobacco use and electronic cigarettes in our undergraduate and postgraduate. So these are my messages.
Thank you, Dr. Sonu, and I agree with you, because India is one of the 34 countries which has very comprehensively banned electronic cigarettes. And we should not be rather talking about electronic cigarette as a cessation device, because this is an illegal product in India. So thank you. Dr. Gopal Chauhan, your message for World No Tobacco Day.
Sir, you know that we all as medical fraternity are aiming for healthy society. And we cannot assume that healthy society is possible without phasing out tobacco. We have to very clear that tobacco menace has to be ended, and we need to fix timelines. We have to start with our own fraternity. We have to go to families, then to the society. Ultimately, we have to end this product. Thank you.
Thank you, Dr. Gopal. And Dr. Rakesh Gupta, please.
Yes, my message to the World No Tobacco theme is that it's an apt theme to protect youth against the tobacco industry interference. And I consider that the dog plexus should think that it should be able to engage all its members. In the coming year, the number is very large. If we need to empower them as to how they can be the participants in the tobacco control and for the end game of tobacco, which according to our timeline leaves us with about 6.5 years. It's not a long time, but yes, it's a time in which if the dog plexus members can be empowered, we will have a huge human resource which will be talking about the end game and tobacco control in the earnest, and will be able to help us eliminate the tobacco menace from India. This is my message to the dog plexus members.
And thank you, Dr. Rakesh. And Cyril, please, your message for
Yeah, yes, sir. See, the children are the main target for the tobacco industry. So always Dr. Rakesh G used to say that tobacco-free generation and end game. So these are the very important concept in tobacco control. Really, we have to work hard to protect our children. If we are able to protect our children, the future will be very prosperous. Thank you.
So thank you, Dr. Manisha, Nitin, Doc Plexus, for this wonderful discussion, this panel discussion. And over to Manisha ji, Dr. Manisha.
Thank you so much, Dr. Rakesh Gupta, for driving this very intense discussion on the implementation of tobacco control laws and its importance in saving our future generations. To all our panel of experts, thank you so much for your valuable time and for your wonderful insights on tobacco control and tobacco control policies. It's been a pleasure learning from you and, of course, listening to you. To all our audience members, thank you so much for your active participation in today's session. It's been a pleasure hosting you all. If you have any questions, please feel free to drop them in the chat box below and our experts will get back to you with their responses. Please take care. Thank you so much once again. Thank you so much, Dr. Gupta and Team Cypher, and to all our experts for their valuable time. Thank you once again.